A dedicated team of healthcare professionals, including doctors, surgeons, and nurses, has launched a 7-day pediatric surgical camp aimed at providing free medical care for over 300 children under 18 in the Karamoja sub-region. This first of its kind camp is organized by Amigos Internationales in partnership with the healthcare workers from the Ministry of Health, Mbarara University of Science and Technology, Bethany Kids Uganda, among others, and it is taking place this week at St. Kizito Hospital, Matany, located in Napaka district. The surgical camp provides essential services for children aged between 0 to 18 years, focusing on pediatric general surgery, ear, nose, and throat cases, and the plastic surgery, while expanding its outreach from southwestern and northern Uganda to underserved areas like Karamoja, in line with Amigos Internationales' ongoing commitment.
It is our very first time working with this community. We had a resolution last year that we needed to expand the pediatric surgical outreach program beyond our normal areas of operation. And why Karamoja? Because here, once you're in Karamoja, the next pediatric surgeon you will see is in Kampala, which is in Mulago. You will have to travel over 6 to 8 hours to ensure that you get into a facility which gives you pediatric surgical services. So together with partners and friends, we were able to come up with this team to ensure that we have this mission, this outreach in Karamoja. And we are doing all pediatric general surgery condition, basing from all the children who come, urology, those with conditions like hypospadias who are not able to pass urine well, those who are not able to pass stools well and probably get what we call anorectal malformations, those also who are having corrective conditions that we can operate upon. We're also doing pediatric ear, nose, and throat conditions like cleft palates, cleft lips, but also other masses around the neck. We are also going to be in position to do pediatric orthopedic surgery. We are doing children who are having, might have been born with inability to walk or because of corrective surgical conditions which we can be able to repair. There are quite a number of them. Those that have had malunions basing on previous anomalies they got with their bones, we're also going to be able to repair those as well. But also we are going to give an opportunity for children to get reconstructive surgery for those who may have gotten burns, those who may have gotten other conditions that will require plastic surgery.
To ensure the success of the pediatric surgical camp, Dr. Paul Muliabonga, the Director of Medical Services at Amigos Internationales, mentioned that the team is also conducting a community medical outreach at the nearby Pentecostal Assemblies of God PAG Church in Matany.
To make the pediatric surgical camp successful, we needed to have a community outreach where we are able to screen for these conditions, where we are also able to offer medical outreach to the population here in Matany and also in the Karamoja region. So we came with two teams, one which is going to be based in the hospital doing the operations once we have already identified the team, but also one which will be based in the community. In the community we shall be doing screening, we shall also be doing general medical care, general outpatient consultations, surgical consultations in the surgical clinic, pediatric consultations. We're also going to be doing consultations in diabetes and hypertension for adults. We're also going to be doing free dental and eye care services. So it's a general medical outreach aiming that we can identify as many children as possible which we can bring to the camp. So we're trying to do all these activities together to ensure that we achieve the goal that we're here.
And currently we are in the event. The community is very happy.
Dr. Deusdedit Katerega, Medical Superintendent at St. Kizito Hospital Matany, emphasized the significant unmet surgical needs in the region due to financial limitations, expertise shortages, and insufficient resources, leading to the hospital referring 15 to 20 complex cases monthly, particularly among children, because they cannot perform all necessary surgeries.
One of the most prevalent things has been bone issues. We are not doing general as a hospital. We've not been doing a lot of bone surgeries, I would say. Though we do all the other surgeries that are coming up. Those ones, but we are going to handle that. There are so many children with bone issues, especially bone bones, which we've not been handling. they'll be able to do that. However, bone issues, those are many. We always have a lot of children, either bones which need to be straightened or those which are infected. I would say in a month you may get about 15 to 20 of them coming in. Some we work on, others we have to refer. The cases which seem to be small or in less quantities but very uncomfortable. And that is what we usually need most. Almost every quarter, we may find that we have about 2 children with these kind of issues. Children with the issues with their lips or their digestive systems which are not working well and need immediate surgery.
It's just our gratefulness for the love, your dedication, even leaving all the places where you came from in order to be part of it.
Beneficiaries were grateful for the services offered to them.
After checking my eyes, they gave me these specs. Imagine these specs can even cost you like 150 or 250. This service has really done well. May God bless, in fact, those people. But what we need, they should not stop here. They should always come back.
Amigos Internacionales is a dedicated humanitarian and development organization that has been serving communities since 1967. Originally launched as a mobile dental unit near the Mexico border, the organization has since evolved to focus on meeting human needs and spreading the message of Jesus to those in need. Deluxe Emi Alamu, Light TV, Karamoja.